Summit Healthcare Regional Medical Center in Show Low, Arizona is under the gun.
Every single day, the COVID counts have been increasing. The numbers that we've been seeing out here have been increasing.
Clinton Anderson doesn't work here. He heads a 14-member federal medical disaster assistance team from Colorado that deployed to the hospital to help relieve stress on the facility, which has been inundated with COVID-19 patients.
They have the beds right now, and they have the rooms, and they have the plans. They're just short on staffing.
Short because the disease has also stricken medical workers, which is why the team's 9 nurses have come to supplement the ones that are still here.
You know, they're working day in and day out. They're working long hours, they're working overtime, and they're passionate about what they do, but they're just exhausted overall.
Unlike Colorado, whose peak in coronavirus cases hit in April, Arizona is peaking now. More than 3,200 cases and 97 deaths on Wednesday. More than a quarter of all tests have come back positive, the highest rate in the nation.
We expect that our numbers will be worse next week and the week following in terms of cases and hospitalizations.
Arizona Governor Doug Ducey is blamed by some for the surge, for failing to aggressively respond to the pandemic. Anderson, the emergency preparedness manager at Colorado's UC Health, wants to reduce frontline workers' virus exposure. Make sure
We are wearing the proper masks, and we're wearing the proper PPE, whether it's a face shield, goggles, that type of thing. The longer things go on, just the more lax we get in compliance, and that's just human nature, and it's no different in the hospital.
Nurse Beth Weeks says some patients have been in this hospital for a while now. She's fighting hard to save them.
You know, those patients are fighting to get better as well. Every day they say, you know, I want to go home. I just want to be able to breathe. So they're fighting very hard. And in that way, it's kind of inspiring.
Arizona hopes to avoid the nightmare of cases New York encountered in the spring.
Just putting in steps where that if that does happen, we'll be in a much better place, in a much better position.
Just off an overnight shift when we spoke to her, Weeks' 2-week stint here is nearly over.
Everyone's tired, whether it's in healthcare or in private industry, in all the industries, and so we're here to come in and provide some relief, and I think that's a crucial role.
At a time when some hospitals, some communities are experiencing this pandemic as if it only recently began. Hendrik Sabrandi for CGTN, Denver.